The Care Quality Commission has a responsibility to monitor how the Mental Health Act is used in relation to people who are detained in psychiatric hospital. We have just published our first report since we inherited this responsibility from the Mental Health Act Commission. Community treatment orders are used when someone leaves hospital and the hospital have decided that they need to be supervised in relation to taking their medication. What we have found is that a large number of community treatment orders are being used. When this piece of legislation was introduced in November 2008, it was rather controversial. Some people thought that it might not be necessary, others were very much in favour of it. During the course of the year, 45,000 people have been detained in psychiatric hospital. Of these, on discharge, 4,000 people have been put on community treatment orders. So the question for us is that appropriate? Maybe some of those people would be prepared to take their medication without a community treatment order. And we're also worried that there are a disproportionate number of people from Black and minority ethnic groups who are placed on community treatment orders. These are questions that we need to consider, and we believe the sector should consider in relation to the use of this new power under the Mental Health Act. A key theme that runs through our report is the importance for each individual patient of having the opportunity to participate and to be involved in determining their treatment. This empowerment, this opportunity for participation is vitally important, and even though you may be restricted under the Mental Health Act, it's really important that as much as possible you are enabled to fully and actively participate in that treatment. It's a basic human right. And it's something that we believe passionately at CQC. And we know that wherever possible, if this happens, it does enable and enhance that opportunity for people to make a full recovery. We are concerned that although we have seen some really good examples within psychiatric hospitals of full participation, there are some cases where there's need for some improvement. Patients are at the heart of our regulatory work, and we are determined that if necessary, we will use our regulatory powers to bring about improvement and drive out bad practice. We owe that to the people who need mental health services. We have a concern that some people on community treatment orders may not fully understand the conditions or what it actually means. And this suggests that they may not have been fully involved when a decision was made to place them on a community treatment order. We would say this is very poor practice, and we know that actually, for things to work well, people need to fully understand and to be fully involved in decisions about their future care and treatment.